Hello everyone, welcome to Pediatrics by Dr. Anand. This is the Unacademy NEET PG platform, and today we're going to talk a very important topic, something known as our very good topic that is today. One of the topic is infectious disease, and the subtopic we're going to cover about various important conditions like mumps, like chickenpox, and like enteric fever. So let's see how much we cover in this session. It's a very beautiful session. I want you to participate as much as possible. I am Dr. Anand, so let's start the topic. And this very important, very beautifully, we are having this NEET PG 2022 All India mock test. I want everyone to participate in this NEET PG 2022 All India mock test, which is happening on 26th of February at 9 a.m. Very good questions we have put there. It's in a very beautiful format. I want you to participate as fast as possible. Just you have to go and enroll. In this one, it's free of cost and it will be really good. All India NEET PG 2022 mock test. In the Unacademy, very important, I would like to say, in the Unacademy we have something known as plus subscription, and in Unacademy we have something known as iconic subscription. In the plus subscription we have, or you get to access to all the live and recorded classes of mine. You get to study from the best of the best educators. You get to compete in live test and quizzes, and you can watch me on your iOS, laptop, Android, any device, and n number of MCQs we have. In the iconic subscription, you get the Unacademy platform and you get the prep ladder subscription, all the clinical notes, treasure, notes, question banks, video lectures, rapid revision, everything you get on of the iconic subscription. So we have the plus subscription and the iconic subscription. This is the month-wise plan, and if the plan look little heavy for you, then you can use this code. It will be little financially comfortable for you if you use this code, because as a student it becomes sometimes difficult to buy a pack. So this code will be little helpful for you. Also, congratulations to FMG December 21. People who work hard always on the top. So I want you all who are working so hard in our classes, I want you also to be in the top. Every educator has a class at 9th, 10th, 11th, 13th, 14th. Everywhere we have this mind-blowing classes. Please attend the classes of every faculty. It will be good. Special class in the Unacademy, we have something known as special class. If you are a newcomer, download Unacademy and join the special class feature, where most importantly we ask questions in a MCQ format, and it becomes easy and it brings you confidence while clearing the questions, and you can ask any doubt. All the lectures are properly recorded and proper synchronized manner. It is there. If you want to revise pediatrics also, you can nicely do that on the Unacademy app. Also, we have made batches of target next 2023 subject wise batch. We have already started, and we have NEET PG 2022 batch. This is a very good one. See, 21st May 2022 NEET is there, right? 3 months are left. So we have this proper well-defined structure plan, where most importantly we have a revision class, then self-study, then subject-wise grand test, and then solution discussion. So you must download Unacademy and join this NEET PG 2022 all educator revision batch. The previous batches are going amazing. Like we have another batch of Focus FMG 2022 starting from 11th February, and Focus FMG December 2022 comprehensive batch also is there. That's it. And we have the NEET PG Plus subscription. The prices are going amazing with all the discounts. The exam is very near. Watch the videos, take the plan, and finish it off. And that's what we have, this iconic bonanza offer. 6 days, the first 3,000 subscribers, which is from 11 to 16 Feb. This offer is there, and very nice. Nicely, you can save good amount of money. That's it. Let's start the beautiful journey. Today's topic of choice. Today's topic of choice will be infectious disease part 2. Hello Subhashmita, hello Prakash, Osama, Nishi Agrawal. So let's start this beautiful topic. In the last class, I remember in the infectious disease, we had discussed something about measles. In the last class, we discussed about measles. The patient will come with 3C, cough, coryza, and conjunctivitis. Then I told you measles will have a purulent conjunctivitis, whereas Kawasaki will have a non-purulent conjunctivitis. Do you remember that? We have done in the previous classes. Today we're gonna start with the very beautiful topic of the continuation of the measles. And before starting any video, we always have a motivating quote. And today's motivating quote is, "It's okay if you don't like me. It's okay if you don't like me. Not everyone has a good taste." So it's a very chilled out Saturday morning quote. It's okay if you don't like me. Not everyone has a good taste. So that's what it is not. It is not, it is not mandatory that everyone will, love us. It is not important that so much, if I'm doing for someone, that other person might realize it. Some people don't realize that. Some people don't know your value, right? Some people don't understand our value. Some people don't understand our presence. Some people don't understand the real, input we are trying to put. Another person take it very granted. So don't get carried away with such people. Don't get carried away. Don't feel sad. Don't be so emotionally vulnerable. This is so important. Like, don't be so emotionally vulnerable. Like, like so much of sensitiveness is not required. It's okay if you don't like me. Not everyone has a good taste. You can have this, you can think in this code in a very light way and move on with your life. I have seen people, I have seen my friends who are in love or who are attached to some other person. Another person is not responding well in the equal manner, and then the person's studies get affected, the whole day get affected, the output energy, the aura gets affected. So that's what you have to, you must, what you call, understand your true value. You must realize your true potential. You must realize how important you are. You must realize your real aura. I know my real presence. I know my real aura. I know my real energy. So my energy is very, very, very strong, extremely like a perfume it is. You can't, leave it. So that much self-confidence should be there, right? Don't get carried away with emotions. Don't get carried away with emotions, and don't get so emotionally vulnerable, that anyone can come and, disregard you, disrespect you, and you are attached to that same person. No, 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 I will try. Don't do all the drama. It's okay if they don't like me. Not everyone has a good taste. Let's start this beautiful topic. Today's topic of choice. Let's do the continuation, this one of the questions. Yes, so this question in the last class we had done. Let's read the question and let's see how many of us can tell the answers. Child present with history of fever for 4 days along with the seizure. A baby had fever for 4 days along with seizure. A rash developed on the trunk on the day after fever subsides. Once the fever subsides, there's a highlighter of this question. Once the fever subsides, then the rash came. What is my most probable diagnosis? So, what do you think? So, in the previous class, we have already done this. I assume we understand that. Hello, Nidhi. Hello, Umesh, Prakash, Anju, Ibza, Zainab, Osama, Nishi, Prakash, and Subhashmita Sahu. And we have a ID by name Way to Islam. Very good. So yes, in the previous section, we have very beautifully discussed this. The best answer is Roseola infantum. Roseola infantum, which is known as sixth disease, right? And I told you in the previous classes, once the rash, like once the fever subsides, then the rash will come. So that only and only happens in Roseola infantum. It's a recent question, 2015, and that's the highlighter. A rash develop on the trunk on the day after the fever subsides. So Roseola infantum is the best answer. Okay, SSPE is a complication of subacute sclerosing panencephalitis. Is a complication of what? Mumps, rubella, cytomegalovirus, and measles. Who will answer this? It's a simple question because in the previous classes we have done this. So I'm just continuing with the MCQs and let's see if you can answer. Priyanka Seni is answering very good. Prakash, Ibza, Nishi, Agarwal, Umesh, Nidhi, very good. So everyone knows about it. Measles. So which is the most common complication of measles? The most common complication of measles is otitis media. The most common cause of death in measles is pneumonia. I'll repeat again, three MCQs. MCQ number one, the most common complication in measles is otitis media. PG entrance question number two, the most common cause of death in measles is pneumonia. And PG entrance question number three, the most common late manifestation, late complication is nothing but SSPE. Like late means after 5 years, 7, 10 years. So SSPE, subacute sclerosing panencephalitis. Okay, where I have to do a lumbar puncture, I'll do a CSF studies, and then this and that we have done in the previous classes. Okay, very good. Let's move which is not a complication of measles. Okay, that's a good question. Which is not a complication of measles? Recent question, 2012. Cataract, encephalitis, pancreatitis, and meningitis. What do you think? Which is not a complication? If this question comes, what will you answer? Anju, Sujit, Prakash, Umesh, Nishi, Osama, and Very good, Umesh. Very good. So, what do you think? Yeah, which is not a complication of measles? In book says usually not C, but A. A. Who said Zainab Akhtar is right? Cataract is not a complication of measles, and encephalitis can happen. See, remember, encephalitis and meningitis happens in almost every problem. Mumps also patient can have encephalitis, meningitis. Chickenpox also can have all those complications. So, encephalitis, meningitis can happen in everywhere. Pancreatitis also the book says can happen in measles, but eyes problem, cataract, no. Cataract, that's what the book says. Cataract is not a complication of measles according to Nelson. Okay, next question. Yeah, now this is a good one. Let's see if you can answer. See, that'll show how much you have, how much you remember. True about measles, PGI December 2005 question. Now, multiple options are correct. In this one, multiple options are correct. So, what do you think? Which options are correct? What do you think? Take your time and tell me the answer. What all options are correct in this one? And multiple options are correct. It's a previous type, PGI type question. So what do you think, anyone? Very good. So, okay, beautifully answering Mani Sujit. Very good, Umesh. So, rash appearing first on the leg. Is this line true or is this line false? Rash appear first on the leg. This line is false because I remember the rash in measles, it starts behind the ear, then the face, then the trunk, then the abdomen. Okay, so this line is false. Next one, Koplik spots are seen in retina. This line also is kind of false. Koplik spots are seen in the inner aspect of the cheek in front of the first and second molar. Koplik spots can also be seen in the vaginal mucosa, and even conjunctiva also, but not in the retina. Long-term complications follow in the form of subacute sclerosing panencephalitis. That's very well true about measles. Incubation period is 2 to 3 days. Osama says this line is what you called true. What do you think? What is the incubation period of measles? Who will tell me? What is the incubation period of measles? हमने पढ़ा था ये लास्ट क्लास में. What is the incubation period of measles, ओसामा? कितने दिन का होता है? 2 to 3 days ही होता है. कब होता है incubation period of measles? Anyone? Exactly. So after 10 days, or you can say, yeah, exactly. So yeah, exactly. So after 1 week, 8 to 12, 8 to, 8 to 12 days, or 10 to 12 days, something like that. 2 to 3 days is not the incubation of period. Okay, exactly. 10 to 12 days, 12 to 4, एक हफ्ते बाद आता है. मैंने इतना रखना, एक हफ्ते बाद मीजल्स के सिम्टम्स आने चालू होते हैं. So incubation period is after 1 week, so 8 to 12 days. So this line is false. It is caused by a RNA virus. That's very true. Yes, it is caused by a RNA virus. Okay, it is caused by a RNA virus. Okay, very good, very good. Perfect. Next. Okay, again, the last question again about measles. True about measles, what you call PGI June 2004 question. So again, I'll give you 10 seconds to answer this question. Multiple options are correct. Multiple options are correct. So what do you think? What can you tell about the measles? Anyone? Any random guesses? See, that's why we do lot of MCQs, so that we can get an idea of overview of the picture of anything, how the things look like. Okay, what is true about measles? PGI June 2004. Okay, so okay, let's do the easy parts. What is true? So fever stops after the onset of rash. Is this line true or is this line false? Fever stops after the onset of rash. This line is false. It is true about Rosella infantum, but not about measles. Okay, vaccine is given at 9 months. Of course, MR1 and MR2, 9 months and 15 months. So this line is true. Measles and rubella vaccines are given at 9 months. That's true. Okay. It is not diagnosed when coryza and rhinitis is absent. It is not diagnosed when coryza and rhinitis is absent. So see, the only true things about this thing true about measles is Koplik spots appear in the prodromal stage and vaccine is given at 9 months. Only these two lines are right. It is not diagnosed when coryza and rhinitis is absent. No, it इज अ फॉल्स स्टेटमेंट। ऐसा कहीं लिखा नहीं है कि अगर कोराइजा और राइनाइटिस एब्सेंट होगा तो मीजल्स हो ही नहीं सकता। नॉर्मली कफ कोराइजा एंड कंजंक्टिवाइटिस इज व्हाट देयर we see, but that's not a diagnostic sign. Diagnostic and pathognomic sign is Koplik sports. So these option number D is false. It is not infective before the rash appears. That also, that's not true. You know, it is like minus. Remember, you remember? Yes or no? -3 and +5. So if you measles rash, no. So 3 days before and 5 days after the rash, that is the period of communicability. In measles, it is -3 and +5. 3 days before and 5 days after the onset of rash, that whole area or whole duration is the period of communicability. So this line, iska कहना कि it is not infective before the rash appears, this is totally a false statement. It's totally a false statement. Okay, good. Let's move further. Yes, this is very easy, and SSP is a complication of measles. This we have already done. Next one, yeah, measles finish. Let's continue with our other set of topics. Again, a very beautiful motivating quote by Einstein, which says, "Strive not to be a success, but rather to be of value." So see, strive not to be, a success, but rather be of value. There should be some value of yours. See, don't run behind money. Don't run behind wanting to get rich. Okay, just be good at your job, because when you are good, people are gonna come to you. So don't follow the money. Just do the good work. If you do the good work, money will come, success will come. Okay, and just be good at your job. That's it. Okay. So if you right now, just be good at studies. You be good at studies. Don't just cram more and understand less. Be good at your studies, because once you are good, the rank will come. Okay, so strive not to be a success, but rather be of some value. Okay, so let's go. The next topic is very similar, very simple, easy topic. If you are a beginner in this topic, very good. If you are already a student who is revising very similar with me, I have put this topic in a question answer format. Before me mentioning the answer, try to comment in the comment box the answer, and let's see how much do you know. Chickenpox. Okay, chickenpox. Like, how should we start? Okay, Deepak. So yes, Deepak is there online. Hi Deepak, what's up? So Deepak, I have a question for you. So Deepak, I have a question. A 5-year-old boy, a 5-year-old male baby came with complaints of some rash. And you gave me a call saying, "Ke Anand sir, I think this baby is having chickenpox." So a 5-year-old male baby come with some kind of rash. So how, Deepak, how can you evaluate in a busy OPD? How can you detect chickenpox? Any how will you check clinically, Deepak? What do you think? And you can also answer Zainab, Osama, Prakash, Nishi, and our Osama Sheikh. Kaise, how will the patient will have fever? Or will the patient will have rhinitis, conjunctivitis, pain abdomen? What are the cardinal features, or what are the important features of the what you called this one, chickenpox? So whatever you guys are saying, I will write that, and let's incorporate it in a beautiful way. So yes, very beautifully already Deepak has told one very very important line, something known as the rash of the chickenpox is like a dew drop appearance. ड्यू ड्रॉप अपीयरेंस मीन्स जो बारिश होती है, बारिश में जो पत्ते होते हैं, बारिश की पत्तों में जो पहली बूंदें होती हैं, द फर्स्ट ड्रॉप व्हेन इट इज अ रेनी सीजन, द फर्स्ट ड्रॉप ऑन अ लीफ, सो दैट इज नोन एज अ ड्यू ड्रॉप अपीयरेंस। बारिश में पत्तों में पानी की पहली बूंदें जैसी जो होती हैं, ऐसे ही बच्चे का रैश होता है। द वे यू सी द फर्स्ट ड्रॉप ऑफ वाटर ऑन अ लीफ ड्यूरिंग रेनी सीजन, दैट फर्स्ट ड्रॉप काइंड ऑफ अ रैश, kind of a elevation or kind of a thing, it is seen in chicken pox. That is the first point. Second, very important, yes, Vidyashri is answering, the patient will have fever and the patient will have rash. Very good. So very very good, very good. Vidyashri, so Vidyashri, you were there in the OPD. I asked you, like, how do you know this patient is having chicken pox? Sir, you said, sir, Anand sir, the patient was having fever. The mother said the child is having fever and he is having rash. So my first question is, like, After how many days of fever the rash can present in chickenpox? Like after fever with rash on day 4 or day 7 or day 10, when do you expect the rash to be there? Let's go one by one and finish this whole thing. So most importantly, yes, the in the chickenpox the patient will have a fever with rash on day 1. Very good, very good. Okay, द पेशेंट विल सर मदर गिव्स अ हिस्ट्री. आज ही बच्चे को बुखार हुआ और आज शाम तक बच्चे को दाने भी आ गए. सर मदर गिव्स अ हिस्ट्री टुडे ओनली द बेबी गॉट व्हाट यू कॉल्ड fever, and today only the baby developed rash within 24 hours of life. You know, right? I think everyone knows about it. If you don't know, I'll tell you. Fever with rash. Okay, so fever with rash on day, see, fever with rash on day 1, day 2, day 3, day 4, day 5, day 6, and day 7. In the previous class we have already done. Can we have a quick revision? If I have a fever today and today only I got a rash, what will you think of? You'll think of varicella. You'll think of chicken pox. Important ones, let's finish first. If I have a fever with rash on day 5, you will think of measles. Day 4 you'll think of measles. Day 5 you will think of typhus, scrub typhus. Day 6 you will think of dengue, and day 7 you will think of enteric fever. Do you remember this? In the previous classes, first topic only we have done. If you are a newcomer, please watch the previous videos on YouTube and also on Unacademy Conquer NEET PG YouTube channel and Unacademy app. Every single video is free right now. Before it gets locked, before it gets private, watch the videos. So fever with rash on day 1, please think of chickenpox. Fever with the rash on day 2, think of scarlet fever, scarlet fever. Fever with rash on day 3, you will think of smallpox. Fever with rash on day 4, measles. Day 5, typhus. Day 6, dengue. And day 7, enteric fever. Very, 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 very important slide. Well, this is the first slide we covered in the first topic of infectious disease. Okay, let's move further. So again, coming back to the same thing, Deepak admitted one child of chickenpox. So what are the highlighters Deepak was able to understand? Patient was having fever with rash on day 1, number 1. The rash was in the form of something known as dew drop appearance. Dew drop appearance. Okay, what else we are still missing something. How the mother will what it called present with the rash? So parvovirus B19, there is no, like, see, there is no specific duration for that, for the parvovirus. It is usually within 5 to 7 days. There is no specific time which the book has written. It's like very vague. They have told 5 to 7 days for parvovirus B19. Okay, what else now, Deepak? So bro, what do you think? What else the mother will tell you the history? डॉक्टर साहब, मेरे बच्चे को बुखार हो रहा है, मेरे बच्चे को दाने हो रहे हैं, ठीक है? और कोई चीज, एनीथिंग एल्स द मदर शुड टेल अबाउट द किस तरह के दाने हैं? If you ask the mother, if you are a pediatrician on duty, mother tells the baby is having a rash, right? Which type of rash? किस तरह के दाने हैं? What is the specific question will you ask, or what is the specific answer mother will give? Then you will tell कि अरे this is chickenpox, you know. So anyone? Okay, okay, the LC says itching. Okay, difficulty in feeding. Okay, nice. What else? किस तरह के दाने हैं? किस तरह के दाने? डॉक्टर साहब, बच्चे को दाने हो रहे हैं. Only one question you should ask and then it's diagnosed. It is definitely chickenpox. किस तरह के दाने हो रहे हैं? किस तरह के दाने हो रहे हैं? So most importantly in Hindi we say पानी वाले दाने. Watery vesicular rash. Very, very important. The patient will have a papular vesicular rash. Okay, so what is macule, what is papule, what is vesicle? So macule is nothing but change in color. So change in the color will be known as a macule. चेंज इन अ कलर प्लस एलिवेशन, अगर उठाव है, एक तो मेरा तिल है यहाँ पे, इट्स लाइक अ मैक्यूल, जस्ट चेंज इन कलर, it's a macule. And my upper lip mole, there's a change in color but there's a little elevation also, उठाव है थोड़ा सा, तो that is known as papule. So change in color plus elevation plus watery discharge, watery, fluid filled, I would say, fluid filled, that is nothing but vesicle. So mother gives a history exactly. ओके, जैनब अख्तर सेज, सर मैं कब से कह रहा हूँ वेसिकुलर रैश कह रहे हूँ। वेरी गुड, वेरी गुड, वेरी गुड, आई एम वेरी हैप्पी यू आर सेइंग राइट। सो दैट्स व्हाट, सो मदर गिव्स अ हिस्ट्री, भाई डॉक्टर साहब बच्चे को पानी वाले दाने हो रहे हैं। डॉक्टर, माय चाइल्ड इज हैविंग मैक्यूलो पैपुलर vesicular rash. Are you understanding? Okay, let's revise again. What are we studying? Infectious disease. Which subtopic? Chickenpox. How the patient will come? Fever with rash on day one. What kind of rash? Like a dewdrop appearance, or like a maculopapular vesicular rash, like little watery fluid discharge is there from my rash. Okay, beautiful. Are you understanding? Yes, I hope this much we are able to get the whole topic. Very good. 10 more minutes, then this topic is over. So chickenpox was so yeah, this is, see, this is a real patient of chickenpox. What are these things? क्या बोलते हैं इनको? Can we appreciate this? Chicken, what is this one? What are these things? This one. What is this black thing? Any yeah, very good. It's a clinical knowledge. We are very fortunate that we are seeing this patient. Our patients only are our real teachers. Can we see this rash? कैसा होता है rash? आप तो कह रहे थे डॉक्टर दीपक, आप तो बोल रहे थे पानी वाले दाने होते हैं, इसमें मुझे पानी तो नजर नहीं आ रहा। डॉक्टर दीपक, यू आर सेइंग इट इज अ ड्यू ड्रॉप अपीयरेंस। आई एम नॉट एबल टू सी अ ड्यू ड्रॉप। ये तो बहुत काले काले बहुत सारे मार्क्स हैं। दिस इज अ टिपिकल सीन ऑफ व्हाट यू कॉल्ड black patches. So what is this? What is this? What is this? So anyone, what do you call this rash, or what is happening in this patient if you talk about? So okay, so I have a question here. So let's see. Okay, this is a very typical picture. Okay, so as you said, the patient will have a maculopapular vesicular rash, right? So let's see, do we have Osama, tum ho online? So Osama, tell me one thing, bro, that this Osama is there or not there? Osama, are you there online, or should I ask someone else? Okay, very good. Yes. So Priyanka, let me ask Priyanka. So Priyanka, I have a question to you. The question is like, okay, so my wife is pregnant. My wife is pregnant. Me and my wife are planning to visit Osama. ठीक है? He is one of my very old junior and very good follower. So my wife is pregnant and we are planning to visit Osama. Okay. So but Osama is having chickenpox. Okay. My wife is pregnant. Me and my wife are planning to visit Osama, but Osama is having chickenpox. So question is, when me and my wife should visit Osama? So what is the answer for this question? Umesh, Osama, what do you think? When me and my wife should visit you? Like again, when before the onset of rash, or after this fluid-filled discharge is over? When me and my wife should visit you? What is the best answer? What is the best answer? Will you say, Anand sir, when dash happens, then you should visit we should your with your wife? Okay. Very good. Nishi, Mani, Priyanka, Sani, very good. Very good. After the rash, Udit Sinha. Okay. So the best answer to this question is कि भाई, first of all we should know what happens to this rash. ये होता क्या है इनका आगे? ये जो पानी वाले दाने हैं, this watery discharge, fluid discharge is there. What should we do? Like what happens later? So this पानी वाले दाने, all the vesicles basically later get crusted. All the vesicles later get crusted, leaving this black patches. Please remember, for the learning experience, this is not a dewdrop. This is not a dewdrop. This is after the dewdrop. ये पानी वाले दाने ये नहीं हैं। पानी वाले दाने पहले होते हैं। ये तो पानी वाले दाने ब्लैक हो चुके हैं। पानी वाले दाने, the watery marks were the maculopapular vesicular rash. But this is nothing but when all the vesicle gets crusted. So here can you see all this black things are that these vesicles are now got crusted. So the answer to this question is, when all the vesicles get crusted, that is means then the period of communicability is over. When all the vesicles are crusted, period of communicability is over, and me and my wife should visit Osama. Okay, has everyone understood this much? Please put a like button if you're able to understand the topic. Okay, very good, fine. When all when all the vesicles get crusted, we should visit Osama. Okay, done. That's it. That finishes good part of varicella. Let's just have a rapid this one. The subtopic is divided into what are the cause of varicella, mode of infection, period of infectivity, secondary attack rate, clinical features and complication. Cause. Okay, anyone? Chickenpox is caused by what? Zainab, Nishi, Vidyashri, Osama with a very wonderful white heart. So chickenpox is caused by which virus? Way to Islam. Very good. So yes, chickenpox is caused by which one? Varicella zoster virus. Which virus? Is it the RNA virus, DNA virus? Which virus it is? So chickenpox is caused by, of course, everyone knows varicella zoster virus, which is a DNA virus. Very important. Chickenpox is caused by varicella zoster virus, which is a DNA virus. That is the first point. Hmm. And what is the mode of infection? See again, if you are a student who's revising chickenpox with me, that's why I'm putting in a question answer format. Before me mentioning the answer, please tell me how can you get chickenpox? Options are by droplet infection, by hematogenous, by lymph node, by which route basically we can what you called get the chickenpox. So very true. Vidyashri is right. Airborne. It's like a droplet, like a airborne. It is basically airborne. Okay. Very good. And what is the period of infectivity? I told you that's what. See, from 1 to 2 days before the rash until all the vesicles get crusted. Very important star mark PG entrance question. Very good, Zainab, Vidyashri, Osama, Dr. DS. Very good. The people who are answering, you guys are 5 steps closer to get a rank. Anyone wants to get a rank in this group, reply and try to comment with the answers. Your rank will be sure. Okay, so period of infectivity is nothing but from 1 to 2 days before the rash and until all the vesicles are crusted. And remember, let's link and study what is the period of communicability of measles. ऐसे लिंक करके पढ़ोगे कभी नहीं भूलोगे, एक साथ सब कुछ याद हो जाएगा. Who will tell me? Zainab, Savan. So Savan, why bro you have come late? जल्दी लेट उठा ब्रो. सो व्हाट इज द पीरियड ऑफ कम्युनिकेबिलिटी ऑफ मीजल्स? मीजल्स में कब होती है कम्युनिकेबिलिटी? एनीवन? सो द निमोनिक वाज -3 एंड +5, राइट? सो रैश, सो 3 days बिफोर एंड 5 days आफ्टर द रैश. 3 days before and 5 days after the rash, वो पूरा time, that is the period of communicability. Whereas period of communicability in the chickenpox is 1 to 2 days before the rash until all the maculopapular vesicular rash get crusted. Very good. Perfect. So, this is very good question. People with varicella should be isolated until the lesions crust over. Are you connecting with me? This line is very important. Connect with me soulfully. People with chickenpox should be isolated until lesions crust over. We have an isolation ward. We have a specific dedicated isolation ward in our hospital for chickenpox people. There should be a must. There must be an isolation ward. Okay, because people will otherwise they will spread. So people with varicella should be isolated until lesions crust over. Okay. Yes, and remember, very important, the secondary attack rate. The secondary attack rate also is very high. The disease is highly contagious. Again, it's a PG entrance question. It's a PG question. Secondary attack rate is roughly how much percent? Means again, can I have chickenpox? Like in general, the secondary attack rate is 80% and disease is highly contagious. Highly contagious. Okay, and that's what. So we have done about the rash. The whole thing we have done. Let's just have a overview of it. Rash appears 24 to 48 hours after a prodromal symptom. What is prodromal symptom? Same fever, malaise, lethargy, not eating well, decreased appetite. These are prodromal symptoms, right? So the rash will appear 24. I told you, right? Fever within first day mostly. So if fever with rash on first day, you'll think of chickenpox. So the rash appears 24 to 48 hours after prodromal symptom, then rapidly to the face, same like a measles. See, measles rash was behind the ear, then the face, then the trunk, and then the body. Here, not in the chickenpox, it is not behind the ear, it is just the rapidly to the face and then trunk. And very important, everyone knows, then there is papule, like macule, then papule, then vesicle, and then they get crusted. So that's what. So now again, everyone knows about it. Very importantly, 7 days वाला वो था, क्या बोलते हैं उसका, होता है मम्स वाला, होता है मम्स का होता है. सो करेक्टरिस्टिक थिंग, द करेक्टरिस्टिक लीजन ऑफ चिकन पॉक्स इज simultaneously presence of skin lesions in varying stages. Very important PG entrance question. Chickenpox is the only disease. Chickenpox is the only disease where you have all types of stages of rash are present at the same time. Means, what do you mean by that, sir? Here I'm having a macule. Here I'm having a maculopapular rash. Here I'm having a maculopapular vesicular rash, and here I'm having all the black crusting. So can we appreciate macule, papule, vesicle, crust? All the various types of lesions, all the various of types of lesions are present at the same time. And what do you call this condition? This is nothing but known as pleomorphic rash. This is nothing but known as pleomorphic rash. Again, star mark. I'm telling you, we need to remember the important things. Okay, chickenpox is the only bimari disease where you have a pleomorphic rash. Pleomorphic rash means all the like the vesicle, cluster, what you call crusted, everything is there at the same time. Okay, done. That's it, done. And also, remember the incubation period. The incubation period of chickenpox is 10 to 21 days. Means till 3 weeks. Till 3 weeks it will go. Who will tell me what is the incubation of period of measles? Savan, what is the incubation period of measles and what is the incubation period of chickenpox? Who will tell me? Measles का क्या होता है incubation period? Osama, Savan, Vidyashri, Faraz, Zainab Akhtar, Umesh. So what is the incubation period of measles? You have to link and study. Otherwise, the syllabus will never get over. You have to link and study. Who will tell me? Very good, very good. The incubation period of measles, yeah, usually it is 8 to 12 days. एक हफ्ते बाद चालू होता है, ठीक है, मीजल्स का. और ये वाला भी एक हफ्ते बाद होता है, पर ये 3 हफ्ते तक रहता है. 10 to 21 days is what you call our chicken pox, and roughly 8 to 12, 10 to 12, 10 to 14, इतना ही, that is incubation period of measles. And subclinical varicella is very rare. Please update in your notes. Subclinical means 99% is clinical chicken pox. I will have a rash, crust, this, that, fever. This is clinical. Clinically, you will see. If chicken pox is, how do you diagnose chicken pox? It's a clinical diagnosis. Look at the patient and tell, sir, I think this looks like a case of chicken pox, right? So, but subclinical chicken pox is very rare. That I means that I don't get the rash and I tell the patient have chicken pox. Clinically is must, subclinical is very rare. Now, very nice question. Very good. Is the distribution of rash in chicken pox, is it centripetal और इट इज सेंट्रीफ्यूगल? ये होता क्या है और इसका मतलब क्या होता है? ओके, हु विल टेल मी? सावन, चिकन पॉक्स का रैश कैसा होता है? सेंट्रीपीटल होता है कि सेंट्रीफ्यूगल होता है? हु विल टेल मी दैट? एंड व्हाट इज द मीनिंग ऑफ दिस सेंट्रीपीटल एंड सेंट्रीफ्यूगल? आई हैव नेवर हर्ड दिस नेम ओनली. सेंट्रीपीटल का मतलब क्या होता है? व्हाट इज द मीनिंग ऑफ सेंट्रीपीटल रैश? लाइक द रैश इज मोर इन द पेरिफ्रीज और द रैश इज मोर इन द सेंटर? लाइक व्हाट इज द मीनिंग ऑफ दैट? सो ओके सो ओसामा सोच के बता. सेंट्रीपीटल मतलब सेंटर से पेरिफ्री बोल रहे हो आप? वो what is the meaning of centripetal? Okay, what is the meaning of centripetal? ठीक है, centripetal exactly petal exactly. So हाँ, remember petal, centripetal, petal मतलब पेट, मतलब टमी. From outside, the rash is less over the peripheries and more at the center. Centripetal में, पेट मतलब सेंटर में सबसे ज्यादा रैश होंगे और पेरिफ्रीज में कम होंगे. इसे बोलते हैं सेंट्रीपीटल. और एक होता है सेंट्रीफ्यूगल, वो उसका उल्टा होता है. सेंट्रीफ्यूगल इज अपोजिट. द रैश विल बी लेस इन द सेंटर एंड मोर इन द पेरिफेरी. दैट इज सेंट्रीफ्यूगल. ठीक है, फ्यूगल. Is my voice coming to everyone?